Next, let's talk about the gastric bypass, also known as the Roux-en-Y gastric bypass. Now, this operation, it kind of has two different components that go along with it. One component involves making the stomach small. The second portion of this operation, though, also involves rerouting the small intestine. And because of that, it has a component that is malabsorptive as well. So these two things combined help produce the weight loss that goes along with it. So this is one of the best operations out there to treat acid reflux. Additionally, this operation has some great benefits with neurohormonal changes that can go along with it that lower your urge for eating. Along with that, it also has some baggage. One, because of how we're rerouting the small intestine and you're not absorbing as many of the calories that you're taking in, that also means you're not absorbing as many of the vitamins that you're taking in. And so it does have some additional vitamin requirements that go along with it. Additionally, because of how the small intestine has been reconnected there and things along those lines, it does pose some additional risks, particularly with certain medications like NSAIDs. That's going to be your aspirin, your ibuprofen. Those can put you at an increased risk of ulcers. And so we ask you to stay off of those medications. Steroids can also pose that same risk, as can smoking can pose a significant risk of ulcers. There's also a risk of something called a stricture, where the scar tissue at the connection point between stomach and small intestine forms too intensely. That can form a narrowing that makes it a little difficult to eat at times. And sometimes we do have to do an endoscopy to help enlarge that just a little bit in order to help. Also, because of how we reroute the small intestine, there's a risk of something called an internal hernia, where the areas that we close down in creating these spaces, if they were to come back open, the bowel can kind of get trapped in there, and that can require a reoperation. It's an uncommon complication, but it is something that can happen. It's usually not a major issue, but it is something that can go along with the operation. But this operation can be one of the best operations, particularly for patients who have a large hiatal hernia, who have issues with gastroparesis, where the stomach doesn't function and doesn't empty properly. People who have had severe reflux esophagitis, where they've developed things like Barrett's esophagus, which are changes to the esophagus that have increased cancer risks with it. This can be a curative operation in that scenario. It's also a very good operation for treating severe diabetes as well. So it does have a lot of pluses that go along with it, in addition to some of that additional baggage.